morning, everyone. I'm Hunter Worth, and I will be presenting on the disease pneumonia. Okay, today I will cover the definition, statistics, discovery, variations, causes, symptoms, diagnosis, treatment, vaccine side effects, differences, and then I'll open the floor to any questions. Okay, the definition of pneumonia is when one or both lungs become inflamed or the air sacs become inflamed, and the air sacs may fill with fluid or pus, causing cough with phlegm or pus. It can also cause fever, chills, or difficulty in breathing. A variety of organisms can cause pneumonia, such as bacteria, viruses, fungi, and parasites. This is a picture or x-ray of a chest that has been infected with pneumonia. This little blurry part shows inflammation. Okay, statistics. About every 20 seconds, a child dies from pneumonia, and pneumonia kills more people every year than any other infectious disease, such as AIDS, malaria, or tuberculosis. And in 2009, the United States hospitalized 1.1 million pneumonia patients, and out of that 1.1 million, 50,000 died. Pneumonia is the leading cause of death among children and the elderly. Pneumonia was first discovered by Hippocrates. He was a Greek physician. This is a bust of him. He is known as the father of medicine, and he was the first to define pneumonia and some of its symptoms. This is a picture of Jewish philosopher and physician Moses ben Maimon. He also described some of the symptoms, but he described more of them and he went into depth. The symptoms he gave are very similar to the modern day symptoms for pneumonia. This is a picture of German-Swiss pathologist Edwin Klebs. He was the first to observe the pneumonia bacteria in the patient's airways, and that led to the cause of the disease. This is a picture of Albert Frankel. In 1882, Karl Friedlander and Albert Frankel discovered the two most common causes of pneumonia, which were Klebsiella pneumonia, which was a bacteria, and pneumococcus, which was also bacteria. Okay, there are three main types of pneumonia. There is community-acquired pneumonia, hospital-acquired pneumonia, and healthcare-associated pneumonia. Community-acquired pneumonia is the most common type of pneumonia, and the patients are infected outside of the hospital and healthcare setting. The majority of the patients obtain the disease by inhaling germs that live in the mouth, nose, or the throat. About 4 million people are affected each year, and 1 out of 5 people need medical attention. Okay, hospital-acquired pneumonia. Hospital-acquired pneumonia, the patients are infected during their stay in a hospital for another disease. They have a higher risk. Patients who use a respirator, which is a machine to aid the patient's breathing, have a higher risk of becoming infected. And hospital-acquired pneumonia has more risk than community-acquired pneumonia because the patient's immune system is already weak and it's harder for them to battle off germs. Also, hospitals have more antibiotic-resistant bacteria. This is a diagram of a patient that's hooked up to a respirator. Okay, the third type of pneumonia is healthcare-associated pneumonia. Patients are infected in nursing homes or outpatient clinics. This is a picture of the elderly in a nursing home. Okay, causes. Pneumonia is caused by microorganisms. The more common causes are viruses and bacteria, and the less common causes are parasites and fungi. Viruses. They're inhaled into the lungs and they line the airways of the patient. They take over the cells to reproduce, and that eventually leads to the cell's death. The viruses cause the body to become weak, and bacterial infections can happen at that point, and it can complicate the disease. Okay, bacteria. Bacteria enters the lung by airborne droplets or through the bloodstream, and the most bacteria live in the upper respiratory system, such as the nose, mouth, and sinuses. The bacteria take up space between the cells and the alveoli, which are the small air sacs that that switch out oxygen and carbon dioxide. The bacteria travel through the bloodstream and can cause destruction to the brain, kidneys, and the heart. Fungi pneumonia is very rare. You don't really see many cases of fungi pneumonia. And fungi pneumonia happens in people with immune system issues due to AIDS or immunosuppressive drugs. Fungi pneumonia is mainly caused by these 5 types of fungi: the Histoplasma capsulatum, Blastomyces, Cryptococcus neoformans, Pneumocites, Pneumocystis urobetsi, Coccidioides immitis. And those are the types of pneumonia that can cause, these are the types of fungi that can cause pneumonia. Okay. Parasites usually enter the patient through the skin or orally, which is through the mouth. They can travel through the blood to the lungs, and a combination of the cells they kill and the immune system response cause problems in oxygen transportation. Symptoms of pneumonia include fever, sweating, and shaking chills, cough, which brings up mucus, sore throat, chest pain when you breathe deeply or cough, shortness of breath, fatigue or muscle aches, nausea, vomiting or diarrhea, headache, and abdominal pain. Diagnosis. Pneumonia is usually diagnosed by cough, the respiratory distress, fever, or x-ray changes. On the left is an x-ray of a person that is totally fine and does not have any pneumonia. As you can see, the chest is clear and there's no infection. On the right, this is a picture or x-ray of a patient that does have pneumonia. This little blurry spot right here shows inflammation in the lungs, and that's how you can tell there's pneumonia in that area. Treatment. The treatment depends on the germ that's causing it, and the earliest treatment is best. So when you know or you see any symptoms of pneumonia, you should probably get checked out. The treatment continues until all the symptoms are gone. A patient should always have good hygiene, a proper diet, and they should get their vaccination. For bacterial pneumonia, antibiotics are usually used to kill the germs. And for viral pneumonia, you should just treat the symptoms like cough and the headache. Vaccines. Vaccines that prevent bacteria or viruses that can cause pneumonia are pneumococcal vaccine, Haemophilus influenzae type B, pertussis, varicella, measles, and influenza or the flu vaccine. This is a picture of an influenza or flu vaccine being sucked into a shot, a syringe. The best way to prevent pneumonia is to get your flu shot. The people who should get a flu shot are the young children, elderly, pregnant women, and people with chronic health problems. The 2 main bacterial causes of pneumonia are Haemophilus influenzae and Streptococcus pneumoniae, or pneumococcus. The vaccines together can save about 1,075,000 yearly child deaths, and both vaccines have been recommended by the World Health Organization. The prices are reasonable and they already meet the international criteria. The vaccines have side effects, but they're not bad. Death is extremely rare, and within a few days of getting the shot or vaccine, mild swelling, redness, and soreness where the shot was given might occur. Less than 1 people that have the vaccine have fever, muscle aches, more severe swelling, pain, or redness where the shot was given. There are also side effects where people can have allergic reactions to the ingredients. They can have behavioral changes, breathing difficulty, including wheezing. They can have a hoarse voice, high fever, hives, pale skin, rapid heartbeat, and weakness. These are my references, and I will now open the floor to any questions, comments, or constructive criticism.
You said that the flu vaccine could cause pneumonia. You said that's getting that vaccine because it's in it.
The vaccine can't cause pneumonia because the vaccine uses the dead pneumonia cells, and that can't infect a person. I'm sorry, where did you see that?
Either I'm probably just confused and said the way it's printed, or it was the slide before you said that was the way it's printed. Probably.
Maya?
What are immunosuppressant drugs?
There are drugs that can suppress the immune system. They don't let the immune system do its job or work. Ms. Lau?
So you mentioned a bunch of different vaccines that can help prevent the pneumonia. And so some of them, I understand because you said like some of them are the causes, like Haemophilus, influenza B, type B, or the pneumococcal vaccine. So they're the causes of pneumonia. But what about like the other ones like varicella or other stuff? Like why having that vaccine will help prevent?
Well, if you have those types of diseases, you're likely to get pneumonia because your body is weak and they contain germs that can cause pneumonia.
When is a good time to get a vaccine?
To get a vaccine, it's a good time when you're a little child, or if you're getting old, or you're pregnant, or you have chronic health problems,